Welcome to the American Board of Ophthalmology Oral Examination website. The oral examination is designed to assess a candidate's clinical knowledge as well as diagnostic and clinical judgment. By completing the written qualifying examination, candidates have demonstrated basic cognitive knowledge. The oral board examination will assess specifically how a candidate applies basic clinical knowledge in a hypothetical patient encounter. The accompanying video is designed to provide you with an understanding of the format and pace of the examination that will hopefully aid you in managing the oral examination. A few reminders. The oral exam consists of 6 25-minute examinations in paired subjects. You should plan to arrive at the examination promptly 15 minutes in advance of the start time. Please do not bring cell phones, pagers, or other electronic devices. In addition, you should not bring briefcases or bags of any kind if possible. Before the examination, you will be greeted by the board director in charge of your examination. He or she will review with you the mechanics of the examination, but will not examine you directly. Your examiners will be colleagues, and they are to administer an examination that is both fair and objective. Also, it should accurately reflect the information and skill that a board-certified ophthalmologist should have. Before the examination begins, it is important for you to sign the grade sheet. The examiner will then initiate the exam by showing you a clinical scenario, most commonly with an accompanying photograph, and will ask you to generate a historical inquiry, a diagnostic workup, and a management plan. Remember that your examiner will not give you feedback about your answers and may in fact interrupt you and move on to another case. His goal is to increase the sample of cases, and because this is a timed examination, it is in your interest to get through as many cases as possible in the presented time available. It is important to structure your answers appropriately so they are inclusive but succinct. Answers should include a clinical history given pertinent negatives, an accurate and succinct description of the clinical findings in front of you, a focused differential diagnosis, key diagnostic maneuvers, a management plan including treatment and appropriate follow-up. You may be prompted by the examiner at times during the test. If so, you should reflect your answers accordingly. The following is a sample encounter that will give you an idea of how questions are presented, as well as an appropriate answer by the candidate.
Good morning, Dr. Lim. I'm Dr. Brandt.
Good morning, Dr. Brandt.
Welcome to the American Board of Ophthalmology Oral Exam. Please have a seat. Before we get started, I would like you to go ahead and sign in on the exam sheet to document that you are here. Thank you. And go ahead and take your exam booklet and open it up to case number 1. This 22-year-old college student who wears contact lenses presents to your office with pain and redness in her right eye for about 48 hours. What would your assessment of this patient be?
Well, this looks like a photograph of a patient's right cornea, and there's approximately a 3 millimeter well-circumscribed central white corneal opacity, and it looks like a corneal infiltrate. I also see that there's a hypopyon in the anterior chamber.
What history would you like to know from this patient?
I'd want to know if there was any history of trauma to the eye. I'd like to know the pattern of contact lens wear and how the lenses were maintained, if there's any history of dry eye or contact with contaminated materials, previous corneal disease, and whether the patient was using topical medications such as steroids or some type of topical anesthetic.
And what would your differential diagnosis consist of?
Well, given that history, my differential diagnosis would include primarily infectious corneal infiltrate, secondary to either bacterial, viral, fungal, or a protozoan infection.
What would your examination include?
My exam would include, first of all, documentation of the vision and pressure. I'd assess the eyelids for any evidence of blepharitis. I'd then look at the cornea for an epithelial defect related to the infiltrate. Concerning the infiltrate itself, I definitely document its location, size, and depth. I then look to see whether there was an anterior segment reaction, and I'd finish up with a dilated fundus exam.
What would your diagnostic workup include?
Well, if my primary diagnosis is a bacterial infection, I would do Gram-stain for bacteria. I would also send blood and chocolate agar plates for culture, as well as do culture media for fungi. If there was something in the history that made me particularly suspicious for acanthamoeba, I'd send cultures for that as well. And it'd probably be a smart idea to culture the contact lens case.
How would you manage and follow this patient?
The first thing I'd do is put the patient on broad spectrum fortified antibiotics. For example, I'd use fortified tobramycin and cefazolin every 5 minutes and alternate that every 30 minutes. And I would do that around the clock. I plan to see the patient in a day's time and look at the culture results to see if they've come back. If the cultures and sensitivities have come back, that would allow me to really hone in on a specific antibiotic choice.
What if the culture came back positive for Pseudomonas?
Given that information, I would treat with a topical 4th generation fluoroquinolone or even fortified tobramycin.
How would you manage and follow this patient?
I definitely see the person on a daily basis and just see how they're responding to the antibiotics. If the lab results confirmed my initial diagnosis and there were signs of improvement, I'd probably begin to taper the eye drop treatment and follow up until the ulcer looked like it was completely better.
Let's move on to the next question, Dr. Lim. Please turn to tab number 3.
We hope that this demonstration has been helpful in preparing you to take the American Board of Ophthalmology oral examination. A final word. Remember that the examination is designed to assess your clinical knowledge and judgment in handling the broad array of issues that will confront the ophthalmologist. Consider it as a kind of patient encounter simulation. With this in mind, you can prepare for a successful examination.